together. The kidney updates had been the annual event we all do. We had been doing it over a decade. How many years now? A lot. So, but then we had this big hiatus. You know, the last time we had was April 2019. Thank you. What happened in April 2020? COVID. So then we planned another event last year. We had to postpone, cancel. So so we are coming back. In respect of COVID, we have some COVID topics today. So we have expert speakers who will be sharing the view about COVID. I know that I have to go through these introductory slides. I know, is Tracy inside or outside? It's okay. Tracy, I must go through this?
We need to have you just show the accreditation.
Okay, I have to. So you see that we have, the CME office. Tracy leads that CME office. I love them. No, I didn't say however yet. I'm just trying to get my thoughts together. I think they go by the book, which is good. That keeps us online. So thank you for doing that. So maybe a round of applause for Tracy and her team. So we have to thank our sponsors. So I would like to maybe zip through some of these slides, but these are some of our platinum sponsors, how we call them, platinum or premium. We were kind of going back and forth. So Bayer, the Dialysis Care Center, Fresenius, the slide deck just goes, Pharmaceutical, Otsuka, Highmark, Natera, and UPMC Pinnacle Services. We have other sponsors, Amgen, GSK, Vifor, right? AstraZeneca, again Otsuka, and Penn Medicine, Takeda. So this is your planning committee. I'm leading the course as the course director, but you know what? I'm no one without my team. This is truly a teamwork. It takes a village, that is true. So thank you, every single team member. Sorry, the slide deck keeps going. Can we just make sure that it doesn't go ahead of me? Okay, he said no. Presenters, please be careful. So maybe we can work with settings. So some more thank yous. Okay. This is our board of directors of Kidney Foundation. As you all know, the event is planned jointly with the help of Kidney Foundation of Central PA and the Penn State College of Medicine. The CME office is certainly, helping us a lot. Yes, this is the most important thing, right? So and I make sure that if it goes next, I will come back. So you guys have all the Wi-Fi, right? Okay, take the picture. You know what I forgot to enter was the hashtag. So the hashtag, if you are uploading anything on social media, it's hashtag kidney updates. That's it, no year, kidney updates. So some of the objectives, which you will learn as we go through. So credits are important. So we have AMA credit, we have nursing credits as well. 6.25 AMA, PRA Category 1 credit, it based on time. We have Pennsylvania Academy of Nutrition and Dietetics. How do you say it, the last word?
Dietetics.
No, the word is, okay, dietary credits as well. And we have social worker credits as well. So this was, I think Phyllis has worked hard to make sure that we have all the credits, not just AMA, CME credits. Some of the disclosures, which will be shown, and then I have disclosure. We have some committee members who have disclosure. We will make sure that all the conflict of interests are managed, and then we have several of presenters who do not have any financial disclosure or conflict of interest to share. So this is probably very important, the evaluations. So you will get CME certificate after you complete the evaluation, not before. Right, Tracy?
That is correct. And we will have this slide for you as a handout at the desk if you'd like to pick that up so that you have the link, and you'll also receive it in your email tomorrow.
Thank you. So I want to go back to the previous slide. So the credits, so my request and ask to you is that please make sure that you fill that survey. I reassure you that I read every single word of the feedback and share with the committee as well. Anytime we plan next program, it's really based on the feedback. We really contribute, your feedback contributes a lot to our future meeting plannings as well. So some of the reminders, trust me, I did not put these, I feel like going back to please silence. Yeah, I need to do that too. My pager is on. So I make sure that I also practice what is written there. So can we now close the slide deck? Because I think that is a disturbance. I want to share a personal moment today. As I was driving today and entered the hall, to see everybody, one thing that really struck me, I was missing Dr. Carroll. So we all know him. Dr. Lawrence Carroll, he is the founding nephrologist, and he started the HKS, right? The Lancaster Nephrology Group. Sorry, I'm pointing towards Lancaster, so I shouldn't do that. He was probably one of the, he's been through all these meetings. He helped us with the planning of all these meetings. He served as the chair of the board of directors for the Kidney Foundation. He, altruistic, philanthropist, educator, loves music, he writes. But he was he was very inspirational. He really asked all of the team members to do something above and beyond. He really pushed us. I remember used to be with him in the board, and he discovered potential in everybody, and he asked us to do above and beyond. So in honor of Dr. Carroll and those who have left us through the COVID, maybe we should observe a silence for 1 minute. Thank you. So the other thing which I was thinking is, what I want to speak with you is that, why are we here today? What are we doing, right? Maybe this is the question we need to ask. What is the common denominator that all of us are here? To me, it's really for our patients. So whatever we do, in the end, our patients get benefit from it, right? What do patients have in common when they come and see us? If I have to distill down, I see that they are suffering. Patients suffering, they are in pain. You have seen patients, you probably have seen patients who are cramping on dialysis. That is suffering, right? They are suffering because they are short of breath. They are suffering because they don't have any energy at the end of dialysis. They are suffering because they are waiting and waiting and waiting to get the kidney transplant. They are suffering because they don't know what they sign up for. They are suffering because of the fear of unknown. There is too much anxiety. There is too much pain. There is suffering, right, Susan? So there is suffering is very individual to the patient, right? What all of us can do or think about is how I can reduce somebody's suffering. Sometimes a smile, just compassionate hand holding, that gets them a lot. So when I see my patients in the clinic, and I think this is where Dr. Garamani is not here, he'll probably join us later, we just discussed that. So I tell my patients who are, in advanced stage CKD that I try my best to keep you out of dialysis as long as possible, but if and when you need it, I will hold your hand and walk you through. And when you are on dialysis, maybe your next step is transplant. So we try to navigate them through the journey. All of you have the capacity, power, experience, and will to help offer patients the same thing, right? So we all need to working on reducing the suffering of the patient. And this is my ask to you. This is my ask to all of you, my request to all of you, maybe a small challenge to all of you, that try to remember or get 3 important facts from this meeting today. Because we are here, yes, we are here for fun, we are here to meet our friends, we are here for the experience of the conference, but we are here to learn, right? So I really challenge myself and challenge all of you to try to learn at least 3 simple facts, 3 simple knowledge things, 3 simple experience things, which you can go back, take it back to your patients, and try to help and reduce the suffering of your patients. Are you with me on that? Who will do this? I make sure that I do this. I probably will write this on the piece of paper. If you want to help us, you can type this in the feedback as well. So my challenge exists. Try to remember 3 facts that will help your patient.